The last drug I want to talk about is marijuana. Marijuana is considered a hallucinogen because it changes one's perception. Generally, the drug that we know is driving the effect of marijuana is THC, or tetrahydrocannabinol. We know THC is driving the effect because there are ways we can grow it so that THC is not present in such things like Charlotte's Web, which is used to extract things like CBD oils and other things like that. And when smoked or consumed, most people say it does not create the high effect. Whereas if we extract the THC and concentrate it in waxes and oils and hashes, people who smoke just the pure THC says, yep, that's getting high. So that THC seems to be the driving chemical in marijuana for its effect. THC affects the endocannabinoid system and has a wide range across the brain. It affects our appetite. It affects our cognitive ability, our movement ability. It can affect nausea, appetite, memory, learning, stress. In fact, it can even affect our sense of time by slowing down the neurons that actually count time, causing our perception to either increase or decrease the flow of time. Right? It is a drug that has long been touted as either the cure-all for everything or a drug in which murder, insanity, and death, reefer madness, lies. This is a drug that is highly divisive, right? And lots of claims are being made about it. And we're on sort of this uptick swing as more and more states legalize it for not just medical reasons, but recreational reasons. And all kinds of claims are being made about marijuana and its ability to help anxiety disorders, pain, nausea, depression. And the problem is most of this research is worthless because it turns out it's really, really, really hard to do research on things like marijuana or psychedelic mushrooms because these things are Schedule 1 drugs. The United States federal government rates drugs along a schedule, and that's what determines research dollars. Schedule 1 drugs, by definition, are considered to have no accepted medical use in the United States. That means there are no research dollars available federally for it, which means that to do research requires private funding. It's incredibly difficult, and we're seeing very poor quality research as a result. Even things like cocaine and methamphetamine are Schedule 2. Which means that there are some medical uses, and therefore we see a lot of research into those drugs, and we know a lot more about them and their effects. Right? So the classification of marijuana as a Schedule 1 drug at a federal level means that most of the research into it has been terrible. They're short in length, an average of 2 weeks. They lack power. They have a small population, small data sample. They tend to be retrospective in nature, where they're just looking at people who smoked or didn't smoke, or rather than having people smoke marijuana, they use an oral preparation. And they don't control for things like the presence of other mental disorders or tobacco use. And generally speaking, there's very, very difficult to draw any conclusions from the research that's being done because of its classification. But at the same time, even though we don't have good research to know what the heck is going on with marijuana, we are rushing ahead in some places with legalization. For example, right now in Denver, there are more marijuana dispensaries than Starbucks and liquor stores combined. When they shut down Starbucks and liquor stores in Denver because of the COVID crisis, marijuana dispensaries remained open. Right? There has been a dramatic shift in our perception of marijuana in this country, and it's not being driven by good data. Right? I'm not sitting here against legalization of marijuana. Don't take that impression. The main emphasis I'm saying is what we need is we need better research. Right? For example, a lot of research is suggesting that marijuana is not very effective in the treatment of post-traumatic stress disorder. That it's probably not a good idea to use marijuana regularly, and it probably makes the anxiety worse long term. Yet the number one reason why marijuana is prescribed in New Mexico, PTSD. Right? We're not being driven by science and data. My argument is that the federal government needs to get itself together, reclassify it as Schedule 2 so that the quality research can be done. Right? So that we can be someplace other than it's a cure for everything, right? Or we're all going to die if we even smell it. right? And more people are trying to say that marijuana is completely harmless. That's not true. It's a drug. And like a drug, there are effects. One of the areas of the brain where we see the most dramatic effect is in the hippocampus, which is responsible for memory formation. And there can be a 10 to 12% volume reduction in the hippocampus. That's loss of brain tissue. That brain tissue is gone. It's possible that it returns with cessation of smoking marijuana, but it can have a dramatic long-term effect on one's ability to learn and remember even years after smoking marijuana has stopped. So there is a negative effect. Right? So again, my argument is reclassify it, let's do the research, and let's have our decisions move forward based on medical knowledge and science. Just as an aside, this applies to any time we're trying to look at a drug and the treatment for anything. Politicizing it is a terrible idea, right? And we're now seeing that with COVID treatments, right? We're talking about like the hydroxychloroquine, right? That's become a political issue. Right? Whether or not you support the use of hydroxychloroquine as a treatment for COVID has now become a Democrat and Republican issue. That's crazy, right? We need to drive it based on medical research, right? And, there's been a lot of sort of anti-science movement lately in that regards. And it's a nasty pattern that I hope can be reversed. But I'll get off that soapbox for now.